Okay, Vlogtober day 7. Here I am at the Sonoma Creek Inn where we're spending the night. We didn't tell you yesterday because we wanted to get home before anybody knew out on social media, as you can understand. So it was loud this morning. So I'm going to actually walk to, hey morning, hi. I'm going to actually walk to the conference. It's a medical conference on geriatric medicine. And I looked on the maps on Google and it looks like I'm supposed to go down this road. And it should take me, if I just stay on this road, taking a left, should take me all the way to the hotel where the conference is. And I'll let you know a little bit about it. The conference is at the Fairmont Sonoma Mission Inn, and this place is beautiful. But you know what? I'm glad I stayed at the Sonoma Creek Inn. Sonoma Creek? Anyway, I'm glad I stayed where I did because it costs about $200 less a night. They usually have a pretty good spread breakfast at these things. And the crowd's all here, and as you can see, it's an exciting group of family physicians, and that's about as exciting as they get. Okay, done with the first day of the conference. Had some interesting talks, particularly by Dr. Larry Johnson from University of Arkansas. I spoke to him to see if maybe he would actually grant an interview tomorrow. I'm hoping that he will. He spoke on the evidence on not primary prevention, but rather screening, general screening for prostate cancer in men. And in the past, we've had the PSA test has been used, and also digital rectal exam. Digital rectal exam being simply placing an examining finger in the anus of the patient to actually feel what the prostate contour is, and showing some very interesting data on that is not intuitive, but I've been seeing a lot of data to suggest this in the past, that we're not really preventing deaths, prostate cancer deaths, by doing this, both the PSA test and the digital rectal exam. So the evidence is not finding that people are alive because these tests are done, but yet that's very hard for the public to accept. For example, you have people like actor and comedian Ben Stiller saying that he attributes his being alive today to the PSA test that discovered his prostate cancer when he was in his 40s. Well, you know, we don't have an identical Ben Stiller who didn't get that test done to see if he would still be alive today, not having gone through that experience. But the data supports that it's not the reason that he's alive today. When you look at the numbers in the studies, we have seen that the incidence of death from prostate cancer has not really significantly dropped since the mid-30s, although that's death from prostate cancer. Although the incidence of people having prostate cancer has increased greatly. Well, it's because we now diagnose it so much more often. We're finding it a lot. Prostate cancer is present in almost all men once they get to a certain age. Even men in their 30s are found to have. In fact, one study that looked at men in their 20s who died of accidental death in, I believe it was Detroit, hundreds of autopsies were performed in this study, and they found that it was like a quarter to a third of these young men had prostate cancer. So prostate cancer exists all over the place. We have to think of it in terms different from other cancers that are a death sentence. The presence of cancer cells in one's prostate is not a death sentence. The problem is some of it's aggressive and will prematurely kill a person. but a lot of it will not cause symptoms. Most people with prostate cancer will die from something else, and in fact, most will not ever have any symptoms from it. So is that something we want to go finding and telling somebody they have to have an operation for it or some other treatment? And by the way, all the effective treatments for it leave patients with urinary incontinence, fecal incontinence, and erectile dysfunction. So it was an interesting talk. It was kind of hard to take. It's going to be hard to explain to patients why we're not doing the testing that they think should be done or can be done to keep them from dying from prostate cancer. But the truth is, they're going to die from something else, almost all of them, because of heart disease and other types of cancers. And if they really want to prevent death from prostate cancer, what they need to do is stop smoking. So I thought I'd try something out that's a little bit different, using the microphone and the wide angle adapter on the iPhone, just to see if you guys like better. And I'm also using a little handle for the phone to see if you guys like this style of production better than me just simply holding the phone and using the in-phone microphone. So maybe compare it to other videos I've comparison, both for picture, for stability, and for audio. We decided to spend the afternoon in downtown Sonoma, and normally I would really get bored with like old towns and antique stuff, but this place has chocolate and has the Mission, and had a gem shop that I found actually quite intriguing and interesting. We're actually here reading a little bit about the history of the Mission, and then actually the Mission was secularized and then taken over by General Vallejo of the Mexican army, and they had an outpost here because they had to have a buffer against the Russians who were settling Northern California back in the I guess the mid 1800s. Instead of wine tasting the wine country, since we're not wine drinkers, we're olive oil tasting.
That was the pear cinnamon.
Pear cinnamon balsamic.
That is the chili. And then you had the peach cranberry.
Peach cranberry, and then this was the mix of...
Mix of peach cranberry and black cranberry. The way that last I'm going to do the same cocktail that I made next door. This. I like that one too.
Yeah. Okay. At the gem shop, they had tektite. Tektite is a very interesting mineral. I read about it at the gem shop. It's a part of an asteroid. The asteroid has struck the Earth super fast. It's a very large asteroid, so large that it creates an explosion large enough for liquid rock to go back out into outer space, and then it super cools and falls back to Earth. And they have some samples of that. Mission San Francisco Solano is the last of the Spanish missions in North America until this one in 1823. I heard the mission bell and I was thinking to myself, this could be heaven or this could be... prickly pear fruit and pomegranates right in front of the mission. And we ate at Sweet Scoops. Okay, time for another test with the lens and the microphone. So again, this is the supposedly better looking and better sounding setup. You guys will have to let me know, because you will be the judge, because you know what you're watching this on and you know what it looks like on whatever device you're watching it on. Please do comment below to let us know what you thought of this video, and if you liked the travel log style, because I was in a different town. I was a tourist for a day, and I just kind of showed you what I did. Maybe I left some things too detailed, maybe some things weren't detailed enough. Please write and comment to let me know how you would like for future videos when I do go on a trip, because I do like capturing little videos of the trips and sharing them with family and friends. And specifically, when I'm talking, I'm thinking of people like Boo Boo Kitty and Lindsay Antwine and Tom Ray and my children who are off at college. You are the people who I am talking to. I'm talking to you guys. And then if other people are commenting in the comments, I'll know who you are and be able to kind of think of you when I'm talking to the camera here. So until tomorrow, see ya.